love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Shevanee Nisbett, health educator from the Health Promotion Unit. And on this week's edition, we're going to be speaking to Dr. Nisbett, who is our medical officer of health in Nevis, and she's going to give us a little bit more information on gastroenteritis. Dr. Nisbett, welcome.
Thank you, Shevanee. Thank you for having me on this program. And as you said, we're going to speak a little bit about gastroenteritis. So you'd like to know, I suppose, what gastroenteritis is. Now, gastroenteritis is an inflammation and irritation of the gastrointestinal tract. Now, the gastrointestinal tract starts at the mouth and ends at the anus. So it's irritation and inflammation of this tract, and this results in diarrhea usually and vomiting.
What causes gastroenteritis?
Now, gastroenteritis has many causes. Okay, so diarrhea and vomiting has many causes. So it could be bacterial, could be parasitic. For example, bacterial, it could be E. coli, Shigella, Salmonella, parasites such as Giardia, or it could be viral, for example, rotavirus or norovirus. And we think this outbreak that we are having now on Nevis is due to one of the viruses. We are in the process of doing some tests, sending samples abroad to find out what it is, which one of the viruses it is. The reason we think that it is virus is because it's island-wide. If it were not so, it would be in pockets, discrete pockets around the island, but it's island-wide, and we think it's viral. This is not particularly strange for us, because we see every few years we have outbreaks of viral gastroenteritis. And it's usually in the cooler months of the year. So it's not unusual. We haven't had any for a few years, but we have had an outbreak this year.
What are some of the symptoms of gastroenteritis?
Now, the symptoms, as I said before, would be diarrhea, vomiting. The person can come in with both diarrhea and vomiting, or they can come in with just diarrhea or just vomiting. And also, they can present, along with these, fever, abdominal pains, loss of appetite. Basically, some persons have a headache. So these are some of the symptoms of gastroenteritis.
How is gastroenteritis passed on from one person to the next?
Okay, so it's infectious. Okay, the viral gastroenteritis that we're experiencing now is infectious. So it passes from an infected person to another person via the fecal-oral route, meaning that the infected feces or stool of a patient somehow gets into the mouth of another patient. Okay? There's some thought that it could be respiratory also, but it's mainly fecal-oral route. All right? So whatever small amount of infected stool would get into the gastrointestinal tract of another person, causing diarrhea and vomiting.
Could you please expound on how, some specific ways this could happen?
Contaminated hands, contaminated objects, contaminated surfaces, like doorknobs, food, water, right? So those are some of the ways. We have to be particularly mindful of washing our hands throughout the day for no reason. Just wash your hands, all right? And particularly after using the bathroom and before eating, okay? Because it gets into the intestinal tract, and it must get in some way, whether it's we put objects in our mouth, or we put a dirty hand in our mouth, or we are preparing food and not washing our hands and preparing food for others to eat or get into the water.
Okay, so you spoke about washing hands, which is probably one of the main ways to prevent getting it. Are there any other ways to prevent yourself from getting gastroenteritis?
So prevention hinges on good hygiene and cleanliness. Okay, so we need to, as you said, wash hands frequently throughout the day. If you can't get hold of soap and water, we advise that you use hand sanitizers. Okay. Of course, we have to clean objects such as toys that our children use. We clean them with soap and water, or we can use just a dilute, very dilute solution of Savlon or something like that. Clean toys. Some of them are electronic, so it's a little difficult, but encourage your children also to wash hands often. Let them keep objects out of their mouths. If you're sick, don't prepare food for other people. And I must say here that it's transmitted. Persons get sick very quickly. So within 2 days, you're going to start vomiting and the diarrhea. 2 days of contracting, right? But before the actual diarrhea starts, that person could be infective. So they can actually infect, even though there are no diarrheal stools. And you can infect persons up to 3 days after getting better. Wow. And the symptoms usually last like 3 to 7 days. So if your diarrhea and vomiting lasts 7 days, which we hope not, because it's self-limiting, if it lasts up to 7 days, up to the 10th day, you're still infected. You know, you're just getting over being infective to other persons. So not because you're feeling well again, there's still some virus in the stool, and if that stool somehow gets, because of poor hygiene and cleanliness, gets to another person, you can still infect that person.
Okay, and I know it infects children, but is it also infecting adults? And if so, could you explain?
Like I said, we don't know which virus it is, and we're going to be checking to see what virus it is. But usually rotavirus, which is the most common, that affects children more than adults. But right now we are seeing adults and children being infected. Okay? Remember, if a child gets ill, they can pass it on to their parents. And then there are other people in the house and they can pass it on like that. So it's important then, when we're doing our prevention, we should know that, like I said before, we clean surfaces often. If anybody is sick in the house with diarrhea and vomiting, they clean often. And if any vomit gets on the floor or on bed linen, you wash that bed linen right away. You use some chlorine, diluted chlorine on the floor on the vomit. Clean up the stool, use some chlorine to clean the area, and that would kill the virus. Okay, so Clorox, right? Some diluted Clorox on the vomitus, or once you've cleaned up the stool from the area, you use some chlorine, some Clorox. It doesn't have to be full strength Clorox, it could be diluted Clorox on the area. You wash linen that has been messed up with stool or vomit, and just keep washing hands and not preparing foods for persons to eat if you know you're sick with diarrhea and vomiting. All you're going to do is pass it on.
And what are some of the treatments for the gastroenteritis?
Gastroenteritis, due to viral cause, there is no antiviral, and the antibiotics are not going to work. So it doesn't make any sense to go to the doctor and say, I need an antibiotic because I have diarrhea and vomiting. Okay? So antibiotics are for bacterial infections, and so viral infections will not respond to antibiotics, so it doesn't make any sense. So basically it means if you keep vomiting and having diarrhea, you're going to lose fluid. So you will get dehydrated. Some persons get mild dehydration, some moderate, some severe dehydration. So it means replacing fluids, oral rehydration fluids. And if it's severe dehydration, it means you must go to the emergency room and you will have to have IV, intravenous fluids, to replace the fluids that you have lost. Okay, so basically it's replacing fluids that you have lost. Now, if you're caring for children, you have to know that if they're having excessive vomiting and diarrhea, that you need to know the signs and symptoms of this, of dehydration. So the child would be lethargic, not having any energy. Their eyes will look sunken, okay? If it's a baby, the soft spot on the scalp would not be full. It will be depressed, and the child just won't have any energy. So you know that child, and children and older people are very susceptible to loss of fluid, to dehydration. So they must have their fluids replaced. So don't waste any time. Once it's children and older persons, they must, I would advise that you go to the hospital with them to be assessed. They may not keep them. All the child may need is just to continue breastfeeding or just to give them some oral rehydration fluids. But there are some of them who will have to be hospitalized and will have to get, IV fluids.
Well, you just said breastfeeding, continue breastfeeding. Now, if you have a child that has that virus and the child is breastfeeding, does that increase your chances as a mother who's breastfeeding of getting the virus?
No, that does not increase the chances of the mother getting, no. Okay. You have to continue breastfeeding because that might be all that the child is taking. Some people want to stop, but no, you can continue breastfeeding.
When did we notice the first case in the Federation, and how many do we have right now?
Well, I can't say when the first case, when we saw the first case in the Federation, because I think there may have been cases in St. Kitts prior to in Nevis. I'm not sure. So I'm not sure even when we saw the first case at the hospital, right? I can't recall that right now. But I know that we have had an increase during the month of February for sure. Okay? It was in February that we saw this increase. And so far, we have had up to yesterday, we had 106 cases of diarrhea and vomiting together. And in total, diarrhea and vomiting, in addition to diarrhea only or vomiting only, we have had 219 cases so far. So this is a lot of cases. So we have to get the message out about prevention, cleanliness, good hygiene would prevent the spread of the virus. Okay, and persons must recognize that if there's excessive vomiting and diarrhea, please go to your nearest health center, go to your physician, and go to the hospital, get assessed to make sure that it's not excessive and it's not, life-threatening, especially for children, because they lose fluid quickly.
And lastly, are there any words of advice, any last words of advice for parents and teachers? Because I know the teachers are going to be dealing with the young children and the parents have to deal with them at home. Any words of advice while we're ending?
Well, words of advice will remain the same. Cleanliness, good hygiene. In the daycares, I don't think we have had any daycare closed because of it, okay? And we don't want to see that happening. So once we see there's a child that is sick, we advise that that child will stay home. And up to 3 days after that child is well, keep that child at home and monitor the other children. Keep doing what you're doing, cleaning the environment, cleaning surfaces often, encouraging children to wash their hands and not take up things off of the floor or and put in their mouth. Practice washing their hands before they go to eat and after they have used the bathroom. And just general things that we know, okay? General things that we know that will prevent illness. It's surprising the amount of illnesses that we can stop by just washing our hands.
And thank you for listening. That has been this week's edition of Health Matters. I would like to thank Dr. Nisbett, the Medical Officer of Health in Nevis, for giving us some very interesting and informative pointers on gastroenteritis. And we're advising the general public to continue washing your hands. We're trying to decrease the number of cases of gastroenteritis we have on the island. I am your host, Shevanee Nisbett, Health Educator at the Health Promotion Unit. The fruit of the week is banana. Banana is a high source of potassium, so try to have one banana at least every day this week.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.